And right now, health organizations across the country are trying to figure out what's next after the White House issued a funding freeze last month. This freeze does impact federal assistance, so right now a judge temporarily blocked that order, and programs like Head Start or Research for Children Cancer currently at risk, and people are somewhat confused on what's happening next. So joining me right now, we have Dr. John Van Doorninck. He's a pediatric oncologist from HCA HealthONE Rocky Mountain Children's to help clear up some of these questions. I guess first and foremost, want to say thank you for joining us here this morning. And overall, how has the federal funding freeze impacted families here in the state of Colorado?
Well, as a physician that treats children with cancer, I'm deeply concerned about the proposed cuts to NIH-funded research. The NIH is the major source of funding for biomedical research in this country, and many of the advances in healthcare and medical treatments over the past decades have been realized on a foundation of NIH research funding. For example, the COVID pandemic, the vaccine that came as a result of that and is estimated to have saved 2 million lives was based on a foundation of NIH-funded research. In cancer, since 1990, there has been a 34% decrease in the incidence of cancer-related deaths, translating to 14 million years of life saved. And in my personal world, treating children with cancer, I have treated children with cancer who, had they presented at the start of my career 20 years ago, would not have been able to be cured of their illness, but because of medicines that were available through NIH-funded research, were able to be cured of their disease and walk across the stage at high school graduation and receive their diploma. So bottom line, had the proposed cuts in NIH funding today been imposed, say, in the 90s, objectively speaking, none of the advances that I just referenced would have been realized.
Wow. So
I'm deeply concerned.
Wow. And what about moving forward, too? Is there going to be any changes to cancer research moving forward as well?
There will be. The proposed cuts are really designed to cost shift some of the burdens, the financial burdens of cancer research onto institutions or private foundations. But in reality, many of the institutions conducting the research are not in a position to do so, and so the research, the vital research that's being done at those institutions will be shut down.
Well, we do appreciate you joining us this morning to shed some light on what potentially this could look like moving forward, Doctor. Thank you again for joining us here this morning.
Thank you.
And for more information, you can head over to our website at cbscolorado.com.